Good morning, my name is Dr. Charmaine Fyfe. I'm a registered chiropractor here in Swaziland. Chiropractic basically is a natural healthcare profession that cares for one's neuromusculoskeletal system. That means it cares for your nerves, your muscles, your joints, your tendons and your bones. Chiropractor manages symptoms by doing soft tissue treatment and by manual adjustments or manipulations. When a patient is manipulated, we twist the spine. Sometimes you'll hear a click or a pop, and that means that there's a release of a gas bubble inside the joint and it shifts the joint into the correct position. Okay, this is a spine, and your spine is made up of cervical vertebra, thoracic vertebra and lumbar vertebra. Okay, these are the nerves that pass through these openings here. Sometimes if a joint moves out of place, so if it moves out of place like that, this nerve here will be compressed, and if it's compressed it can cause back pain, it can cause leg pain, it can cause numbness or weakness in that area. So what chiropractors do, firstly we'll work on the muscles that surround that area, and then we'll manipulate, which is what I was talking about. So we twist and you hear a little click, okay? And when you do that there, you're relaxing the joint and you're relieving the pressure off that nerve. Okay, soft tissue therapy is made up of massage, some stretching. We also do something called dry needling. Dry needling, we use an acupuncture needle, but the thing that we do is called dry needling. Okay, so we take the needle and we put it into the knot of muscle to release the flow of the blood and the chemicals in that area. And when we do that, the muscle relaxes and the patient feels a lot better. Okay, when you have a treatment, it is quite painful, but they always say if it hurts, it works, or no pain, no gain. So if you do come in for a treatment, you must be prepared to have some pain. Okay, so you'll come in and we'll do a consultation. We'll find out what's causing your problem, and we'll find out where the problem is, and we treat that area. So we'll do a bit of massage, some stretching, some dry needling if the patient allows. A lot of patients are afraid of needling. And then we do some mobilizations of the joints and manipulations of the joints. Okay. So it's important that when you get home, you also do some exercises at home. So I will show you how to do some nice stretches to keep your muscles in good condition, and also do other exercises to keep your muscles nice and supple and loose. There are some exercises that are bad for you that you shouldn't do. So anything that causes excessive extension of the spine, or anything that hurts you while you're doing it, or any exercise, whether it may be a good exercise, if you are doing it with the wrong posture, then it will definitely cause a problem. Okay, so exercise is very good. Some people, if they've had a flu and they stop exercising for 2 weeks, you'll find that they come in and they have pain because they have stopped exercising. So now their muscles have gotten tight and tense, and then they start to have injuries. Exercise, like I say, is very good for you. If you exercise, your back and shoulders are nice and strong, so they are able to sustain a lot. So if you bend down and pick something, because your muscles are strong, you will be fine. Whereas if you have weak muscles, if you bend down and pick something up, you'll hurt your back. Okay. The foods that are encouraged to eat. So water is very good for you. I would say about 2 to 3 liters a day, especially if you're exercising, you need to drink more water. And then basically dark green vegetables, fruits, whole grains, beans, lentils, fish and chicken are very good proteins to eat. Obviously meat, you would red meat try and cut down on, because it can cause a lot of acidity in your body. Okay, very important to eat well, to sleep well, to sit well. Okay, so my next point is posture. Posture is important, whether it be sitting posture, walking posture, standing posture, or sleeping posture. Okay, the correct way to sleep is on your side with the pillow in between your legs. Okay, if you sleep on your tummy, you have to twist your neck and twist your head, and that can cause some compression on the nerves here, and it can cause headaches. Okay, it can also cause some shoulder ache and cause some back pain because it's twisting the back. Okay, if you sleep on your back, it's good to put a pillow under your knees, because if you sleep on your back, there's a lot of strain in this area here, if you put a pillow under your knees, that happens. So your whole lower back is supported. Okay. The correct way to sit at our desks, sit straight in front of the desk. You've got to pull your chair in completely. Okay. My monitor is here because I don't use it a lot, but you need it to be in front of you, and your keyboard here. Okay. So if you pull your chair in completely, have a nice back support, rest your back and rest your arms on the desk. Okay. So we shouldn't be sitting like this here and typing. We should sit like this here. Nice relaxed shoulders, okay, resting our arms on here and typing like this here. If you sit like this here, there'll be a lot less pressure on your shoulders and your neck and your head, and you'll have less issues with sitting for very long periods of time. Okay. I would like to show you some nice stretches to do, especially for office workers, since most people work in the office and they tend to sit all day. So let's try not to sit for longer than an hour at a time. So every hour or so you can stand up, make a cup of tea or walk around, or you can do some stretches. So I'll show you some basic stretches that office workers can do to relieve the tension in this area, because a lot of the time we get a lot of tension here because, one, we are stressed, we have work deadlines, we're working for too long, just sitting for long. Even if you're sitting with good posture, your muscles will tighten up. Okay, so basically to stretch this side here, okay, you rest your hand and you pull across like that. So it's not like that, it's slightly forward. You'll feel a nice stretch in this area here, okay? And when you do that stretch, you need to hold it for 10 seconds and you need to do 3 of those, okay? And then you'll do the other side. So rest the right arm and pull slightly forward and you'll feel a nice stretch in this area, and hold it for 10 seconds as well and do 3 sets, okay? And the last one is straight down. You pull forward, hold for 10 seconds and do 3 sets of that as well. Another one, the last one, especially for office workers, put your arm in front of you and pull across. And when you pull across, hold 10 seconds and do 3 sets of those, and then the other side. So these are things that you can do throughout your day. Instead of sitting the whole time, every now and again you can stop and do some stretches. Okay. Thank you.